Health insurance is expensive, but lately the premium increases have gotten out of control. So what if you can't afford this? So in this video, I'm going to quickly break down why health insurance costs so much, but more importantly, I'm going to talk about what you can actually do about it. Because most people have been told that health insurance is the only way to pay for healthcare, and I'm about to completely challenge that idea. By the end of this video, you'll know about 2 options that can completely change how you handle your healthcare for less than half of what health insurance costs. And if your experience ends up anything like mine, you'll probably be happier with your healthcare too. So we're talking about saving a lot of money and having a better healthcare experience. Yeah, sounds like a win-win to me. Health insurance is expensive for a lot of reasons. It was originally designed to protect people from big, unexpected medical events like surgeries and hospital stays or a major diagnosis. In fact, the very first health insurance plan started in 1929 at Baylor University Hospital in Texas, and it only paid for hospital care, not routine doctor visits. But over time, health insurance started being used for everything, every checkup, every lab test, every prescription. When insurance pays for almost everything, you're gonna pay for that in your premiums because it adds layers of billing, coding, and approvals. Doctors spend hours dealing with paperwork and insurance claims instead of caring for patients, and many have to hire extra staff just to keep up. Now, according to United Healthcare, the primary reason healthcare is so expensive today is because providers and pharma companies have been charging higher and higher prices, a trend that's persisted for decades. Now that's true, but it's only part of the story. Hospitals set their list prices, called charge master rates, extremely high. And they do this because they know that insurance companies negotiate network discounts behind the scenes, and those discounts only look impressive if the starting price is inflated. So the hospital raises the sticker price, the insurer negotiates the discounts, and both sides can claim they're helping, but patients still end up paying more. In short, hospitals and drug companies drive up the starting cost, while the insurance system, with its layers of negotiations, paperwork, and profit margins, keep those costs high. It's a cycle that feeds itself, and unfortunately, consumers are the ones left paying the price. You might have seen this viral video of a guy calling his insurance about an ambulance bill, and what happens on that call sums up everything I've been talking about. Take a look.
We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
It's this.
You should cancel your insurance. I'm just letting you know that that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
How crazy is that? He paid more because he had insurance. So the first $600 was the self-pay price, the real cost. But once insurance got involved, the hospital had to run it through their inflated pricing system, and the bill came out to over $2,300. Now, after insurance paid their portion, the remaining balance due was $1,200. twice the actual cost of service. And who ultimately pays for that inflated system? The insured. So in the end, you're paying more, but you're not getting more. You can spend hundreds or even thousands every month on insurance premiums and still get hit with surprise bills or network restrictions when you actually try to use it. Look, you don't have to keep pouring money into the very system that's driving costs higher. As I like to say, every day you are voting with your dollar. So if you don't want to support this system anymore, there is another way to handle your healthcare, one that actually puts you and your family first. First, let's talk about how to handle most of your family's healthcare needs. Things like annual wellness visits, sick visits, minor injuries, basic procedures, lab work, and prescription management. All of that can be handled by a direct primary care or DPC doctor. This is your local doctor, someone in your community, but they work differently. They don't deal with insurance. Instead, you pay them directly through a small monthly membership fee. Think of it like Netflix for your doctor, or a much more affordable version of a concierge doctor. And because you're paying your doctor directly, there are some pretty big perks you get as a patient. For starters, your healthcare is between you and your doctor. There's no waiting on insurance approvals or the insurance company telling your doctor that you don't need something because it's not medically necessary. Kicking your insurance company out of your healthcare decisions, that alone saves so much time and frustration. And since your doctor is no longer buried in insurance paperwork, you actually get longer visits with your doctor. Instead of those rushed 7-minute appointments, most DPC doctors will visit with their patients anywhere from 30 minutes to an hour, giving your doctor time to really listen, understand your health history, and take care of you and your family. Most DPC doctors will allow you to text or call them if you have questions, sometimes even after hours or on the weekends. They're usually pretty available to you if and when you need it, including same day or next day appointments. This is what healthcare should feel like. Now, here's the crazy part. Even though more people have health insurance than ever before, about 40% of US adults still put off going to the doctor because of the cost. Now, that's from a PBS report from a few years ago. It's probably the same or maybe worse now. And many of those people, though, were insured. They had insurance. Think about that. People are paying every month for health insurance and they still avoid the doctor because they're worried about what it might cost. And I see this all the time. I was actually talking to a friend recently who said that they were talking to another group of moms and they were all talking about how they never go to the doctor. The last doctor appointment they went to was years ago to an OBGYN when they had their kids. Many of them hadn't had a regular checkup in years. Now, I don't know their insurance situation, but I'd be willing to bet that most of them had insurance. We take our kids to their regular checkups, we make sure they're cared for, but somewhere along the way, we stop taking care of ourselves. And that's exactly the kind of problem direct primary care helps solve. So my family here in Utah pays just over $200 a month for direct primary care, and that covers all 4 of us. Now, if you live in a higher cost area like California or New York, it might be a bit more, but it's still going to be a lot more affordable than traditional insurance. And instead of bouncing from urgent care to urgent care, seeing a different doctor each time, you have a personal doctor who actually knows you, your family, your health history, and your healthcare needs. If you'd like to find a DPC doctor near you, just do a quick search for direct primary care near your city or your town, and you should find several options. I've talked to several people that lived in smaller towns, and they were still able to find a few DPC doctors near them. Be sure to find out what's available where you live. Direct primary care is the kind of healthcare most people don't even realize exists, and it's one I truly hope more families get to experience. Your direct primary care doctor can handle most of your family's everyday healthcare needs, but when something major happens, you need a way to manage the bigger medical expenses. Now that's where a healthshare comes in. It's the other half of the puzzle. A healthshare isn't insurance, it's a nonprofit community of people who agree to help one another with large and unexpected medical needs. Here's how it works. Each month, you contribute a set amount of money to your healthshare. They organize and facilitate the sharing between members, making sure that when someone in the community has a big medical need, those funds are distributed to help pay for it. So let's say you're a healthshare member and you end up getting injured and you now need surgery. You go to the hospital and let them know that you're self-pay. They will usually automatically just give you a discount like we saw in the video I just shared. Now you'll need to pay your member responsibility amount, and that's just the amount that you agree to pay towards your own medical needs before the healthshare steps in to pay the rest. Now, just as an example, mine is $1,000. So if I were to have surgery, I would pay $1,000 and then the health share would take care of the rest. Now you're going to want to ask for an itemized bill and a receipt showing that you paid your share of the bill. So in my case, it would be my $1,000. Then you simply send your itemized bill and your receipt to your health share. Now, depending on the organization, they'll either reimburse you directly or pay your provider to take care of the eligible expenses. That's it. There are no network restrictions, so you can see any doctor or hospital that you choose. And you don't have to worry about will they accept this or not, because you're just going in as a self-pay patient, and then the health share works on the back end. And because health shares are nonprofit, there's no incentive to deny eligible medical needs. Plus, without the insurance middleman, the savings can be enormous. And just like direct primary care, most people don't even realize that health shares exist. But health share communities have been around for over 40 years, collectively sharing billions of dollars in medical expenses for their members. With a health share, you're not paying into a system designed to profit off of you. You're joining a community designed to help you. Now, when you combine direct primary care and a health share, you finally have a complete healthcare solution without health insurance. Direct primary care takes care of your everyday needs, checkups, labs, sick visits, and preventive care, giving you easy access to your doctor whenever you need it. And your health share steps in for the big unexpected things like the hospital stays, the surgeries, or major medical events, the kind of cost that could otherwise cause serious financial stress. Now, for my family's entire healthcare setup, we have both direct primary care and a health share membership. My family pays less than half of what we would pay for health insurance. We're spending significantly less each month. We have more control of our healthcare, and we've had a much better healthcare experience overall. If you'd like to learn more about health shares to see if they're right for you and your family, be sure to check out my next video. I'm going to break down the differences between health shares and health insurance so you can see exactly how they compare side by side and decide which one makes the most sense for you and your family.